So what if I told you that someone in the world has stroke every 40 seconds and most don't even realize it's happening? Imagine going about your day when suddenly your arms go numb, your words won't come out right, and within a minute your life changes forever. The scary part, stroke doesn't wait for anyone. It strikes fast, and if you don't act quickly, the damage could be permanent. But here's the shocking part. Most people ignore the warning signs. By the time they realize that it is too late. In this video, I'm going to tell you the three deadliest stroke symptoms that 90% people miss. What really causes stroke, and the number one mistake that could cost someone their life. And if you know them, you could save a life, even your own life. Stick around to the end of this video because I'm going to be revealing a shocking fact that could cut your stroke risk in half. Let's dive into it. Welcome to Michael's Health Update. Stroke occurs when blood flow to a part of the brain is interrupted or reduced, depriving brain cells of oxygen and nutrients. This can cause brain cells to die within minutes, leading to serious complications or even death. Stroke requires immediate medical attention to minimize brain damage. Types of stroke: you have the ischemic stroke, which is the most common. 87% cases caused by a blocked or narrowed artery due to blood clot or plaque buildup. Under the ischemic stroke, we have the thrombotic stroke, which is a blood clot forms in the artery supplying the brain, and we have the embolic stroke, that's a clot formed somewhere else, which can be the heart and travels to the brain. The second type is the hemorrhagic stroke, bleeding in the brain caused by a ruptured blood vessels leading to brain bleeding inside or around the brain. Subtypes: we have the intracerebral hemorrhagic, that's the bleeding directly into the brain tissues, and we have the subaconic hemorrhage, bleeding in the space between the brain and skull. The third one is the transient ischemic attack, that's the mini stroke, a temporary blockage of blood flow lasting a few minutes to hours without causing permanent damage. It gives a warning signs of a future major stroke. Now let's go to the causes and risk factors. The high blood pressure, that's hypertension, weakens the arteries, increasing rupture risk. Atherosclerosis, fatty deposits, narrowed blood vessels leading to a clot formation. We have the heart disease, conditions like the atrial fibrillation, irregular heartbeat can cause clots. Risk factors: medical condition like the high cholesterol, diabetes, obesity, previous stroke or TIA, that's the transient ischemic attack. Lifestyle factors that causes stroke include smoking, excessive alcohol consumption, poor diet, high in salt, fat and sugar, lack of exercise, drug use. Example, coke. Uncontrollable factors, that's the third factor. Uncontrollable factors with age, especially over 55 years and above. Gender: men have a higher risk, but women have worse outcomes. Family history of stroke. Genetics play a role. Now let's go to the signs and symptoms of stroke. Using the fastest, that's face dropping one side of the face to feel numb or drops. Arm weakness, one arm drifts downwards when raised. Speech difficulty. And the T stands for the time to call emergency service. Seek immediate help. Other symptoms include sudden severe headache, loss of balance or coordination, vision problems, that's blurred or blackout vision, numbness or weakness in one side of the body. TIAs, transient ischemic attacks, they have similar symptoms but resolve quickly. Still, they are major warning signs. Now let's go to the diagnosis of stroke. Physical and neurological exam, that's check movements, reflexes and response. Imaging test, the CT scan, the MRI, which provides a detailed image of brain damage. We have the blood test, check for clotting issues, blood sugar and cholesterol. We have the carotid ultrascan, examines arteries for blockage. The echocardiogram checks for heart-related causes of stroke. Treatment of stroke, emergency treatment, that's the golden hour, first 60 minutes. For ischemic stroke, that's clot related. We have the TPA, a clot busting drug given within 4 to 5 hours of symptoms. Mechanical thrombectomy, a catheter removes the clot from a brain artery, that's within 6 to 24 hours. For hemorrhagic stroke, That's bleeding related. Surgery removes pooled blood and repairs damaged vessels. The second one is long-term stroke recovery and rehabilitation. That's the physical therapy, helps regain movement and strength. We have the speech therapy, restores communication skills. We have the occupational therapy, that aids in daily activities like eating and dressing. And we have the medications, blood thinners, like the aspirin, that's the cholesterol lowering drugs and blood pressure medication. Stroke prevention tips: control blood pressure, keep it low, eat healthy diet, food and fruits, vegetables and whole grains, exercise regularly, at least 30 minutes of moderate activity per day, quit smoking and limit alcohol intake. Both increase stroke risk significantly. Manage chronic conditions, control diabetes, cholesterol and heart disease. Recognize TIA symptoms. That's treat mini strokes as serious warnings. A stroke is a life-threatening emergency that will cause immediate medical attention. Knowing the warning signs and acting fast can save life. With proper prevention and early detection and effective treatment, the risk of severe complications can be minimized. If you or someone around you shows stroke symptoms, don't wait. Call the emergency immediately to save a life or even your own life. For more health tips like this, don't forget to like, share, subscribe, and comment. Thank you.